Good evening, everyone. Thank you for joining us tonight for the Alameda County Public Health Department COVID-19 Child Care Update. We just really appreciate you all for taking time out of your evening to be with us tonight to hear this really important information. We know it's been, sure your days have been long. It's been a pretty hectic day. So again, just want to appreciate all of you for everything that you do for children and families in our county and for being here tonight. Before we get started, we have available for folks simultaneous translation in Spanish and Chinese. The instructions are on the slides. I'm going to give folks a couple of minutes to read over the instructions and to access the interpretation features. And the instructions for in Chinese will be on the next slide. All right, I have a few more housekeeping items for us before we get started with the presentation. A reminder to everyone that tonight's webinar is being recorded and that we will be following up with an email to all registered attendees with the recording, as well as links to the presentation, as well as other resources. Right now, all the attendees are muted and the chat is currently disabled. Please submit your questions using the Q&A box, which you can find in the bottom toolbar of Zoom. Okay, at this point, I am going to turn it over to Lisa Erickson, who is our presenter for tonight.
Hi, everybody. Hoping you can hear me pretty well. Sound good? Okay. I just want to echo what Rowena said. Really want to appreciate you all being here tonight. And I also just want to appreciate all of you for providing care. Basically since March, you guys have been doing this since March. You've been open since March, and just have so much appreciation for childcare providers. And we really want to be here to support you. That's partly why we're doing these webinars, and hopefully we'll do more in the future. Hopefully in the recent future, like so soon, hopefully. And I know it's been a very eventful day, and so just, we have a lot of information to get through, but we're just going to do our best. And yeah, let's get started. So today's topics, we're not going to cover all of the childcare guidance, but we're going to focus on health screening today, because there has been some updates to our health screening guidance. So we want to talk about that. We're also going to talk about a review, how to report a positive case to Alameda County Public Health Department. I'm going to give a really brief vaccine update, because I know you all really want to hear about that. And then if we have time, we're going to go into some of these scenarios for symptoms and positive cases. And then we'll take a few questions at the end. Next slide, please. So health screening. I know all of you right now are doing health screening. It's one of the requirements, the COVID guidance requirements. And we have made a few changes to it. But in general, the three main steps of health screening are, first, the three steps are to ask about symptoms, a visual check, and a temperature check. Next slide, please. So the first part here is called the exposure check. And you want to ask the parent or guardians these two questions, which is within the past 14, and this basically means has the child been exposed to anyone with COVID-19? So the first question is going to be, within the past 14 days, has the child had close contact with anyone in the household who was diagnosed with COVID-19 or who had a test confirming they had a virus. So anyone in the household, have they been exposed? And then the second question is anyone outside the household? Have they been exposed to anyone with COVID-19 outside the household? So exposure check is really important before you get into the other symptom and visual checks and temperature check. One thing to keep in mind here, the close contact, I'm going to go over that definition later in the presentation, but I'll just remind you that close contact means that have you had been within 6 feet of someone for longer than 15 minutes? That's how we define close contact. And that will be written in the presentation later. Next slide, please. So this is the symptoms and visual check. So, and we did have a little bit of a change to this. In our previous guidance, we said in the last 24 hours. So I wanted to point that out. Now we say, since the child was last at the program or in the last 10 days, if the child has been out of the program for longer than 10 days. So we changed that. Something to keep in mind that I really wanted to emphasize here for the symptom check is the emphasis is really on new or different symptoms. Okay, so if the child has a runny nose that they always have or that they've had because they've had a cold that's just continuing, that's not really what we're trying to catch with a symptom check. We're really focusing on new symptoms. And I know this is tricky because I know little kids get sick a lot, but during this time of, especially during the time because we have so much community spread right now, the symptom check is really important. And so these continue to be the symptoms that we're looking for in Alameda County. Some of the counties vary a little bit, but these are the symptoms that that we have in our guidance. Next slide, please. And again, if they check yes to any of those symptoms, please send the child home, or hopefully they don't even come to school if they realize they have those symptoms. And lastly is the temperature check. And again, using the no-touch thermometer, we define the fever as 100 degrees. Sometimes in some of the other screenings, it's 100.4, but for Alameda County, it's 100 degrees. And again, if the child has a fever as defined above, then send them home. Next slide. All right, so that's kind of what's included in the screening that you should be doing before a child enters your care. And I wanted to point out that one of the last slides in this presentation, there's a resource list of resources. And in our health screening document or guidance that's on that resource list, there's actually a sample health screening in there, and it's translated into different languages. So that resource tells you how to do the screening, and then it also gives you a sample. So you could use that sample with your families. You could just pull it out of that document and just use that. Great. So now I'm going to talk, oh, sorry, go back, Rowan. I forgot to talk. So now I'm just going to talk about if they do check yes on that symptom screener. So they have symptoms, or they've been exposed, or they have a positive test. I'm going to talk about when it's okay for them to come back to your program. So I'm going to go through a few scenarios. Thanks. Next slide. So the first scenario, the child's test is positive, or the child is not tested and has no medical evaluation, but so the child may return after at least 10 days have passed since the symptoms have first appeared. And there's been at least 24 hours with no fever without taking any medicines. And this other symptoms such as cough or shortness of breath are improving. So the symptoms need to be improving. So a child they don't need a test to come back, or they don't need a medical evaluator note if they wait the full 10 days, but they have to wait 10 days. There's other scenarios where they can come back before 10 days, and I'm going to talk about in a minute. Next slide, please. So if the child is not tested, but has a medical evaluation, they may return before 10 days have passed. So I know that we've covered this before in other webinars, and there's lots of questions around this, but sometimes there are symptoms that aren't due to COVID, and the doctor or a nurse practitioner, certified physician assistant, they're able to evaluate the child and determine that the symptoms weren't due to COVID. If they're able to give a note to you, then you're allowed to, those children are allowed to come back before that 10-day period. And the symptoms obviously have to be resolved. They need to be feeling better. Okay, thanks. Next scenario. So if the child's test is negative, so they had symptoms, this is a change. So that's one thing I wanted to point out. This is a change to our new health screening policies. So if the child has a negative test, they can come back before 10 days. However, that test needs to be a certain kind of test. It can't be one of those kind of rapid tests that you hear about or antigen tests. It needs to be what we call a PCR test or a molecular test. So if they get a test after symptoms, they can come back as long as it's the right test. And it's pretty easy to see on the test what kind of test they had. It's usually the test that you would get where it takes longer to receive a result. Those are usually the PCR and the molecular test. I do want to, go back. One thing I didn't mention, Rowena. This is kind of what Dr. Gerling always kind of tells me to say, the clinician that I work with, is that ideally the child would still consult a physician if they have access to the physician. The reason why we're allowing this negative test is that sometimes that's difficult. It's difficult to see the medical evaluator, so it is okay to return with the test. But still, it's great to, if possible, talk with a medical evaluator. All right, next scenario. So this is for a child who maybe they checked yes to one of those exposure questions that we just went over. So someone who has been exposed to a possible COVID case. Oh, I just realized I had to change something in the slide based on our new quarantine criteria. So sorry about that. We'll make sure that we change this before we send the presentation out to you. We just recently changed our quarantine criteria to 10 days. So I'll have to make that change. So if a child is home quarantining, and I want to point this out, quarantine is different than isolation. Isolation is what you do when you're sick. When you're quarantining, that's just when you've been exposed to a positive case. You've had close contact with a positive case. That's when you go into quarantine. So that's different. And our new quarantine is that you would need to stay in quarantine for at a minimum of 10 days. 14 days is better, but at a minimum of 10 days. And I'll go through quarantine a bit later as well in the presentation. Let's see, something to keep in mind here, even when you're in that quarantine for 10 days and you haven't developed symptoms and the child is quarantining, they still can't return even if they have a negative test. They have to stay in quarantine. The reason for this is that sometimes you can develop symptoms. It can take up to 10 days, develop an infection. It can take up to 10 days to get sick sometimes. So you really need to stay in quarantine to make sure that the child doesn't become sick. And this also would apply to your staff as well. All right, next slide, please. Okay. So I know that people do still have questions about what to do when you have a positive case. So I'm going to just go through some of those steps, and when in doubt, you can always just contact us. But I'll go through all the steps in detail. Next slide, please. Okay. So the best way to report or to get support for when you have a positive case, if you have questions, you want to talk with us, the quickest way, the best way is to use this email. This email is really, really effective, really efficient. We check it all the time. We have a group, there's 4 of us, and we're constantly monitoring that email and replying and getting back to people. So I'd really encourage you, if you have questions around positive cases, to use this email to check in with us. And we really respond and answer these kinds of questions. I'm sure I've talked to some of you on the phone that are on this webinar already. Any kinds of questions, you can email that email. And you can call as well, but sometimes I think the email is better. Next slide. So what you need to do when you have a positive case, and again, you don't need to report people that have been exposed to positive cases. This is just for positive cases. If you actually have a staff that tested positive or a child that tested positive in your care, okay? So not exposures. I get a lot of questions. What if, What if the child's parent tests positive? You don't need to report that. You don't need to report the parent or that child, just positive cases in your program. You need to also contact licensing. So I believe there's some information in the resources too about how to contact licensing when you have a positive case. But for this is for Alameda County Public Health Department, what you need to do. This is the form here. It's an online form, and you put information in that form about the case. We ask for details like name, information. And the reason why we ask for all that is because we verify this information with what's coming in from our database, from the health clinics and providers and testing sites. So we need all that information to kind of verify the case. And we use this information partly to support you all, but also partly so that we can track outbreaks. So we know if there's more than 3 cases in your program, we can kind of monitor that and help you when and if there is an outbreak. So we're gonna ask for that case, the information, and then we're also gonna ask for information about the close contacts. Slide. So when you're notifying us, when you're filling out this form, these are some of the questions and what you're gonna need to answer when you report the case. First, you're gonna need to determine the case's infectious period. I'll talk about that in a minute. You're also going to determine the case's isolation period. That means how long should that person be out of care, right? How long should the staff stay home? How long should the child stay home? You're going to want to figure out who were the close contacts to that case. Most likely it's going to be that entire cohort, right? It's going to be the close contacts and maybe some other staff if they had interactions. And then you're going to want to refer to the scenarios and protocols, and that's another resource that we share at the end of this presentation. And then lastly, you'll submit that information in that form that I just showed you to the Alameda County Public Health Department. Okay, next slide. So determining the infectious period. And I would recommend actually having, I have this kind of handy, like I print these policies out because I always forget and I have to go back and remember, when is it again? And because there's all these different time periods, right? Quarantine, isolation, infectious period. So just have these resources available so that you can revisit them. So the way you determine if that positive case was at your facility while they were infectious, you go 2 days prior to when they develop symptoms. Okay, so let's say they got sick on a Wednesday, but they were in your care on Monday and Tuesday. That means that they were infectious while they were in your program. So then you would need to figure out who came in contact with that child while they were in your program during that infectious period. So that's what we're trying to figure out. So you can figure out who you need to quarantine. And for sometimes children and staff, they'll be asymptomatic, right? So they won't have symptoms. So you would need to then, their infectious period would be 2 days prior to the day they were tested, and then 10 days after that test date. Okay, so for symptomatic cases, it's 2 days prior to when they develop symptoms and 10 days after the symptoms. And for asymptomatic, people without symptoms, it's 2 days prior to the day they were tested and 10 days after the test date. Okay, next slide. All right. So this is the isolation period for people with COVID or when they're awaiting test results, someone who's homesick. And I already kind of went over this in the health screening, but when you're homesick, it's called isolation. 10 days, you need to stay home for 10 days. And you can't leave unless you can't, be released from isolation. It's 10 days and you have to be 24 hours with no fever, and your symptoms need to have been improving. The way this works is the day of symptoms is day 0. The calendar would start the day after, so that's day 1. And then you release from isolation on day 11. So you have to be out for a full 10 days. And then there's a link here to more isolation instructions for you. And that's also included, I think, at the end of the resource as well, the resource page. Okay, next slide. And eliciting close contacts. So remember, we're kind of going through this step by step. I know it's a lot, but you've got someone, you know that they were infectious, right? They were in your program during that infectious period, 2 days before they had symptoms, or 2 days prior to their test date if they didn't have symptoms. Who came in contact with them while they were at your program when they were contagious? That's what we're trying to figure out, okay? This is close contact. You're only gonna quarantine the people that had close contact. So most likely it's gonna be all those kids in the cohort, as I mentioned, and it might be other people, like other staff. Like, so unfortunately, sometimes I hear staff, they're meeting in the staff room, or I know with childcare, you don't really have staff rooms, but talking, having conversations. That's why we're really trying to avoid this, because the more that you're kind of mixing like that between cohorts, the staff, the more people you're gonna have to quarantine when you have a positive case. Just wanna give you that reminder. Again, the definition of close contact is within 6 feet, closer than 6 feet of an infected person for at least 15 minutes, even if you're wearing face coverings. And then also shorter, intense exposures. If there's, someone's coughing in your face or things like that, that could also be considered close contact. And again, it's not just 15 minutes all at once. It can be 15 minutes throughout the day. So kind of intermittent 15 minutes. So that's a close contact. So a close contact doesn't mean you pass someone in the hall. You wouldn't need to quarantine if you just passed someone in the hall that was tested positive. Really, we really don't want everyone to be quarantining. You don't need to close your whole program. It's just the people that came in close contact. Next slide. Okay, so then the next step, and this is one of the last steps, is you would develop a list of all those people that came in contact, and then share that list with Alameda County Public Health Department. You can just upload a spreadsheet. You don't have to put every single contact into our form. I think you can upload even a Word document, whatever is easy for you. We just ask for, I believe, the name and the phone number of those contacts. Okay, next slide. And then you'll need to give information to those close contacts about quarantine. Okay. And this is important because this is our new quarantine guidance. So again, it should begin the day after the last exposure. So let's say that a child developed symptoms on Wednesday and immediately went home. All the kids that were in that care, that would be the last day of exposure, and their quarantine would begin that next day, right? You would send the cohort home, everyone that was exposed to that positive case, and that day one would start the day after the last day of exposure. And the quarantine period is 10 days, minimum of 10 days, but as I mentioned, 14 days is still the safest option. And if a child, student, or staff member has regular or close contact with anyone with high risk or severe disease, then 14 days of quarantine is required. And there's a link here in this presentation to how it's how the CDC defines high risk or severe disease. So, and you can say 14 days if you want. If you want the children, anyone that tested positive to quarantine for 14 days to be safe, you're more than welcome to do that. But 10 days is the minimum. Okay, next slide. And again, this is just a little visual, a reminder to summarize this. These are two very important concepts. Quarantine is for someone who came in close contact, and that's the minimum of 10 days. And then isolation is someone who's sick. They can be sick or tested positive. They're home isolating. That's also 10 days, and they can't come back until fever's, 24-hour without fever and symptoms are improving. Okay, next slide. And the last step, after you figured out who has been exposed to the positive cases, you need to send them an exposure letter. And there's a template for this letter in the resource at the end of the presentation. We actually are making this template so that you can put the name of the person in. We're making it fillable, what we call like a fillable form. So it's much easier for you to use that template to send to your families. And we also should send you, we have new quarantine packets of information that have like resources for the families who are quarantining and isolating. So we will also share those packets with you as well. I don't think they're actually on our website yet, so I need to get you those links because we had to update them all with our new guidance. Okay, next slide. All right, I think we're making pretty good time actually. Might have more time for questions. So on to vaccine updates. Go ahead, Rowena. Okay, so I'm just going to give just a brief update on vaccines. I think in the future, hopefully we can come back together again to talk more, because there's just a lot to cover with vaccines. But I do think that for now, we're going to do a brief kind of update around the process, and then later we can talk more at a webinar in the future, a little more about vaccines. So how will vaccines actually change the pandemic? So they could potentially reduce the number of people with COVID, reduce the severity of disease, reduce hospitalizations, deaths, and shorten the length of the pandemic. So that's why you're obviously hearing so much like hope and hopefully a lot of people, a lot of encouragement for people to get vaccines because of these reasons. However, we still are at the very beginning of the vaccine, and it's going to take a while for us to kind of reach that herd immunity through this vaccine process. So we still will need to wear masks and do the physical distancing and all the other, mitigation measures that you all are doing for a while, until we have that real, sufficient coverage. Next slide, please. So this slide is just kind of about how vaccines work. Hopefully you can see it. It's hard to read the text, but I can tell you the big yellow bubble here is measles. Okay, so this is what it was like without the vaccine, that big yellow bubble. So before the vaccine, there were 530,000 cases, 217 cases, 1,000. And then as you can see over here, with the vaccine, 61 cases. So vaccines make a huge difference. However, there still are some cases, which is why we need to continue to vaccinate. So that's what this chart is showing. And so this is pertussis, measles, mumps. Hopefully you can see all of them, but it really shows like then, before the vaccine, and now. Next slide. So these are the roles of the federal, state, and local government as vaccines kind of roll out. This is how the process will work. The federal agencies the FDA approves the vaccine, and the CDC determines how the vaccine will be allocated, how it's going to be prioritized. That comes from the CDC. And the CDC also figures out the whole kind of overall framework for the rollout. And then the FDA, CDC, and the NIH do the ongoing. I'm using all of these acronyms. I hope you guys know what these acronyms mean by now. I should probably spell them out. The Center for Center for Disease. What is it even? Disease Control. Sorry, I'm so used to saying the acronyms that I forget what it's actually called. Anyway, I'll get back to that because I want to make sure I'm giving you the right names. Okay, really? Okay. Yikes. Okay. And then the next level is the California Department of Public Health. So then it comes to the state. Okay. So, and then so California determines which vaccines will be used, how much vaccine needs to be allocated to which counties. They kind of figure out our own state specific framework, which data systems we'll use. And we do all the ongoing data collection that happens at the state level of vaccines. And then lastly, the agency that I come from is the Alameda County Healthcare Services Agency, or the Public Health Department. And we coordinate all that local infrastructure, the vaccine storage, distribution, administration, and we're really, really working hard to make sure that there's equitable distribution across communities, and really want to make sure that communities that are hit hardest get the vaccine soonest. And so we've developed this framework, and we're working through a whole process around that. Okay, next slide. And this is what I know that you all really want to hear about, are the phases and when are childcare programs going to be eligible, going to be ready to get their vaccines. So right now we're in phase 1 and we're in phase 1A. So you can kind of see it right here in this column here, this phase 1 box, 1A at the top. So right now we're working on healthcare workers, community healthcare workers, and long-term care facility residents and staff. The state has not announced yet when it's time to go into 1B. As you can see, essential workers is the first part right there of 1B. Childcare and education is part of essential workers in 1B. So you're definitely prioritized, but we haven't gotten word from the state yet. Hopefully that will happen very soon, that childcare and educators will be ready for that vaccine. On to the next slide, please. So as I mentioned, we are in phase 1A, and there's 3 different tiers in phase 1A. That's what we're currently implementing right there, that green section. And very soon, we're going to be entering into phase 1B, which is where childcare programs and childcare workers and educators are in education. Okay, next slide. And as you see here, 1B, right there under tier 1, 1B, essential workers, and there's education and childcare. So and this kind of tells you all the different groups that are included in all these different phases and tiers. It gets a little complicated, but just know that it's, the tiers and the phases and all that, but just know that education and childcare is next in the next, so phase 1B. And I will say at this point, because I'm getting lots of emails as to be expected and calls around when will we know? How will we know? I know the minute I find out, we find out, we will let all of our, resource and referral agencies know, First 5, our Early Care and Education Planning Council, so they can get this information out to you as soon as possible. There might be a need for another one of these webinars when it happens too. We have all of this, everything with COVID, everything happens so quickly. So we'll try to respond as quickly as we can, and try to answer questions that you all will have around the vaccine and how it's gonna work as soon as we can. Once the state okays, because they're the ones that say it's time to move into phase 1B. Thanks. Next slide. And this is just a little bit about, how the decisions get made and a little bit about planning. I won't go into too much detail, but again, there's the California Vaccine Task Force. So there's the Scientific Safety Review Work Group that was reviewing all the safety of the vaccines. The work group to draft guidelines, and there's a Community Vaccine Advisory Committee at the state level. And I know because I'm on these calls with our operations department at Public Health, that they talk to the state on a daily basis about vaccines. We're trying as hard as we can to get the vaccines out. It's a lot. It's a huge, heavy lift. It's a massive undertaking. And just keep in mind too that we're also dealing with a huge surge right now of COVID cases. So it's a lot to manage, but we're definitely working day and night to make sure that vaccines are getting out to the community. Next slide. So this is Alameda County and what we're doing to kind of plan around all of this. We have this multidisciplinary COVAX team, and there's 3 areas. There's a community advisory group. There's the healthcare delivery system that we're working with to make sure that vaccines get out. And there's all the immunization logistics. The community advisory group had met, I believe, on December 21st was the first meeting. And we have childcare representatives there, education representatives, the faith community, community-based organizations. So it's a real broad spectrum. And the goal of that group is to make sure that, there's that equity lens, meaning that the vaccines are getting to the places, the people that need it most. And that we're also doing the trust building because, healthcare hasn't had the greatest history working with lots of populations, especially the African-American population in our country. And we need to do a lot of work to make sure that there's trust and that, it's very transparent. All of this is very transparent. So that's all front and center for all that equity work that we're doing. and working very closely with the healthcare delivery system, which is going to be, I think, really important for you all getting your vaccines, is making sure that you could go to your healthcare provider to get it, and they have it, and that everyone understands that process. And then we're also doing what we call vaccine pods under that immunization logistics, kind of like what we did for the flu vaccine. But for people that don't have insurance and can't get to their healthcare providers, we'll have vaccine pods in the community. So yeah, federal, state, and local distribution is how this all works. Okay, next slide. And again, this is just some of the values and principles, which I already mentioned a little bit, making sure that we're leading with equity and data, making sure the vaccines are getting to the neighborhoods that need it most, focusing on geography, socioeconomic factors, and critical populations. And we know that childcare providers are a critical population to reach vaccines. And making sure that we have all the venues and partners to make sure that there's a wide, broad distribution of the vaccine. All right, next slide. How are we doing on time? Okay. Yeah, okay, excellent. I know this is a lot of information. I'm not used to just presenting and not taking questions while I'm presenting, so it's a lot of me talking. Okay, so I guess now we do have time to go through some of these protocols. I wasn't sure if we were going to be able to, but I think we do. So let's move through them. This is going to be, I think, a review for some of you because we have covered this information in past trainings, but I think it's probably good just to revisit these. So again, these are scenarios when you have, children or staff that are out sick, or they have COVID, or they've been exposed. These are kind of what you do when these things happen. And again, use these as resources and refer back to these scenarios because they will help you. So you don't always have to call us or email us. You sometimes will just know what to do based on what's here. So the first scenario is when a child or staff member exhibits symptoms or answers yes to a health screening question, which we already went over, right? You send that individual home and isolate them while you're waiting for them to get picked up. And you advise them to contact their healthcare provider, consider testing, and they need to share those test results with you immediately, as soon as possible, so that you know what you need to do if they do have COVID, okay? But if they just have symptoms, you just send them home, but you don't need to, quarantine the cohort or let anybody know at this point, unless they have COVID. Okay, next slide. Scenario 2, this is a household member or someone in close contact with a child or staff member tests positive for COVID. So as I mentioned before, this is let's say the child's parent has COVID. This doesn't mean that you need to close your childcare program or quarantine your cohort. It means that you send the child home and you ask that child follow the quarantine instructions, which we already went over, that 10 days minimum quarantine. And they should contact their healthcare provider and consider testing. Testing while you're in quarantine, you may not want to get immediate testing. You wouldn't maybe do it on day 1, but maybe get testing between day 4 and 10. So maybe day 4 and 5, you could get tested to make sure that, that there's, if you do it too soon, the virus won't show up. So you want to wait a few days before you get tested after you're quarantined. Okay, next slide. And we've already gone over this, but a child or student or staff member tests positive for COVID-19. So you know what to do. I already kind of talked to you about the steps around that. So what I'm going to focus on here is what do you do with your cohort, right? You've identified those close contacts. You're going to want to quarantine that cohort. Everyone that came in contact with that positive case, you want them to quarantine. And the reason why this information down here is blue is because this is kind of the new regulations, AB 685. So it's new legislation that was just recently, I guess it's like now because it's January 1st. So this is what we need to do now that it's January. We need to send out those exposure letters to everyone that was exposed. And you also need to do written communication within 1 business day to everyone at the site who might have been exposed. So it's a little different than it was before. You need to kind of send it, a broader communication out to everyone at the site who may have been exposed. And again, the exposure letters or this communication always needs to be confidential. So you don't want to share any sort of personal health information when you notify your child care community about the positive case. Next slide, please. Scenario 4, while a child or staff member has been isolated because of symptoms, they receive a negative test and they want to return to the program before 10 days have passed. We already went over this. I'm just going to review it. The student can come back if the test is a PCR test or a molecular test. So they need to have the right kind of test. And you don't need to communicate this to your school or childcare program. All right, next slide. So a child or student or staff member has been isolated because of symptoms and wants to return to the program before 10 days, but they don't have a test, okay? Again, they can return after they're feeling better, and they have to be at least 24 hours with no fever, without taking medicines, but they need to show that medical evaluator note, okay? So if you go home with symptoms and you don't have a negative test, and you don't have a medical evaluator note, then you can't come back before 10 days. You need to stay in isolation for 10 days. Those are the two ways that you can come back before 10 days have passed. Okay, next slide. So while a child or student or staff member is placed in quarantine following exposure to a case, they receive a negative test result for COVID-19. This question comes up all the time. While someone's, and I already mentioned this, but I'm going to mention it again. While someone is in quarantine, if they receive a negative test, that doesn't mean they can come back. They need to stay in quarantine for the full duration because you don't know if that infection might develop while they're in quarantine. So it's a little, and then if they develop symptoms while they're in quarantine, then it's no longer quarantine. Then they're actually isolating. You need to treat it like they're isolating. If they test positive or if they develop symptoms, they move to isolation. So it's different instructions. And again, I know this is a lot. That's why we're here to help. So you can always call us or email us if you have questions about this when this actually happens and you have questions. I think that's the last scenario, but next slide. Yep, it is. Okay. So we have a little time. I went through those a little quicker than I thought I would.
Yeah, thanks, Lisa.
Sure.
So we have some questions, and thank you all for submitting your questions. We might not be able to get to everyone tonight. We will have a FAQ that will be shared after the webinar. So the first question I have, if we send a child home because of COVID-19 symptoms, do the child's siblings need to stay home as well until the child that is ill is tested or home for the 10 days?
Very good question. You do not need to send the child home, the sibling home, if their sibling went home with symptoms. Not necessarily. However, if that sibling, if there's a strong suspicion that that sibling that went home with symptoms has COVID, then the other sibling should go home. And the way to determine that is if that child had been exposed to someone with COVID and then they develop symptoms, you're going to just kind of assume that child has COVID. You're just going to say the child has COVID because they've been exposed and they have symptoms. In that case, you would send the child home. I want to point out that in the resource that I'm going to show you, that's in one of the last slides of this presentation, there is a resource called a process and protocols for when you have a positive case. And there's some questions at the end of that where we walk through this. We talk about this in writing. So you'll have that in writing in that resource. So that in case you want to refer back to that.
Okay, another question I have. What do I do if staff or a child go home with symptoms or with a suspected exposure and are waiting to be tested or to receive the results of a test?
Yeah, good question. So it's very related to what I just shared around the sibling. If there's a strong suspicion that that staff member or child has COVID, then you can go ahead and quarantine that cohort. So for example, you're going to want to ask that staff or child, have you been exposed in the last, 14 days to someone with COVID? You're also going to want to ask them about their symptoms. Do they have symptoms that could be, like COVID-like symptoms? Like, have they lost their sense of taste and smell? Are they having a hard time breathing? So if their symptoms are very, indicative of COVID, then we would recommend that you go ahead and quarantine the close contacts and that cohort. And this is something that we're happy to help you and assist you with making that determination. I've talked to lots of schools and childcare programs over the last couple months about this, and we often do actually recommend quarantining when the symptoms are, really kind of indicative, or when we really think that they could be COVID or they've been exposed. And and the reason why it's a question everyone has, I know, is because it's hard to get tests right now, right? So oftentimes people are waiting for tests and they're waiting for the results. So that's why we're recommending quarantining when they have those very specific symptoms or when they've had exposure.
Okay. And then another question that has come up, has the group size changed? Is the county the same as the state?
Yes, the county is the same as the state, and it has not changed. So it is still a total group size of 16, which can include children and staff. So you can have as many staff, I believe, as you want in that group size for childcare, but it can't, exceed 16. So yeah, it has not changed. And just want to point out too that there's a childcare FAQ resource on the slide, the following slide, that has all that group size information in that resource, and that resource has also been translated into multiple languages.
I think we have a few more slides that we want to go through. Michelle, I don't know if there are any other pressing questions that we want to, sorry, excuse me, ask.
So there's a lot of additional questions. I just want to remind folks that we will be doing a frequently asked questions and make sure that we're not answering them on the fly, but that we're giving them the attention that they deserve, and so that they're clear. Some of the things are things that Lisa's already addressed. Just some confusion about the actual timeframes, and did the 24 hours change from a 72-hour requirement? And then some legal questions that I think really aren't Lisa questions, but are things that there's some questions about whether you as an employer can require your staff to be vaccinated. I think those are outstanding legal questions that haven't been tried yet, and we're going to hear a lot about that, not just among childcare providers, but amongst all employers. Yes. So stay tuned on those questions. I think we all have questions about, those requirements.
Yeah, I will say that the public health department is not requiring the vaccine. So that question does come up a lot. So I'll just say that right now, that it's not requiring it.
And I think in one of the answers I did respond that one might anticipate that, well, you are going to be concerned about that not requiring your staff to be vaccinated. Parents are going to want the teachers to be vaccinated, and that's just going to be a tension for folks. And then
again, if there's lots of questions about the
sorry, Lisa, I was just going to say, and then conversely, providers are going to want families to be vaccinated, and if the families are choosing not to be vaccinated, how that's an issue. I mean, we already have vaccination issues pre-COVID, and I think that those things are going to bubble up now. Go ahead, Lisa.
I was just going to say that we can definitely coordinate, like I mentioned before at the beginning, another presentation on vaccines where we can get more in depth if people are interested in that and want to learn more about vaccines. We could talk about the efficacy and the trials, and you can learn, because we really want to be as transparent as possible about how the vaccines came to be so that you can make informed decisions. And we didn't have time to do that tonight, but I'm happy to do that. It may not be me doing it unless I can, learn it really quickly, which I've done a lot of this over the last few months. But yeah, we can make that happen.
And then, not to put you on the spot, Lisa, but there was a question about if a family childcare provider who wanted to know if she could have somebody else run her program, who the provider became ill, and if she could stay isolated in the part of her house while somebody else to help continue to run her program.
That's a good question. I think that's similar to what you would see, what we say about substitutes, right? In a childcare center, and we do allow for substitutes. I think that if you were isolating in your home, you would really need to be isolated.
Like the air
truly
isolated.
Truly
like
isolated.
Bathroom, yeah.
To make it safe. Yeah, I mean, really, truly isolated. But I think, yeah, as long as that substitute is allowed to, is cleared and everything to work in your program through licensing, and, you've gone through all those steps, that would be, you don't want to be, we definitely discourage like substitutes coming and going all the time because we want to try to keep staff as stable as possible. But yes, you would be able to use a substitute. I don't see that being any different than in a childcare center.
All right, I'm gonna take us to the next
resource slide.
Yep.
So should I just walk through these resources?
Yeah,
because I was talking a lot about the resources while I was presenting. Okay, so the first section here that says screening, right? That was all what I presented at the very beginning. Remember I mentioned that there's a sample that you can use and just kind of pull out of that document, so you could use that with families. That's there. I think if you guys, yeah, I mean, it might be, I know these are PDFs that are on the website. If you need them in Word, I'm sure I could get them for you in Word if that's easier, if you really wanted to use those samples, but they're there. All that information I presented is in this section here, all these resources. The next one here, the testing page. This is, yeah, all about the community testing, like all the community testing sites, questions about testing, lots of resources there about testing, and that's updated regularly. And then the childcare FAQ. This actually is in different languages, I believe, on our website, so we can get you those other languages, I'm pretty sure. And the childcare FAQ is the one that has all the guidance, right? It talks about the cohort size, the distancing, the mask wearing, it's all of that. So it's pretty important, and I'm sure you all have seen that, and it's totally in line with the state guidance as well. Like, we try to be as in line as possible with the state so that there's not a lot of confusion. So we repeat a lot of what the state says in that FAQ. And then lastly, there's the positive case process and protocol document. This is really long, and that's actually updated now. So this link is brand new. It just got updated today with our new quarantine timelines and the sibling question that I mentioned and all of that. All of that is in this document. It's a long document. I'm just going to warn you. It can be kind of overwhelming. The scenarios that I went over are in this document. And that will be translated as well, hopefully as soon as possible. And we're trying to make our website a lot more accessible. So I'm hoping that will happen in the next week or two. I'm going to be working on that to try to make questions so you can just go to the website and find your question, so you don't have to dive into these really long documents. So we are working on that. But in the meantime, these are here for you. I think that's it. Oh, the other link that's not here that we should probably put in here is our vaccine page. So those slides that I actually shared with you today, they're actually on that website, on the vaccine page. So we'll be sure to share that with you. Sorry about that I didn't include that here. And one thing I forgot to mention, that the community advisory committee that I mentioned, you can actually go onto our website and listen to that if you guys want to hear more about what the community is saying about vaccines. And it's recorded and it's on our website. You can just listen. And you can also join those community advisory committees. the date is on our website, I think, of the next one. You can join via like Facebook Live if you really want to listen in. So we want to make this as transparent as possible, everything with vaccines. So we'll be sure to share that vaccine page for you.
And the next set of resources that we have on here are contact information for our 3 local childcare resource and referral agencies. Please, we just want to emphasize that to make sure that you're connected with your local R&R agencies. This will be one of our primary ways of outreaching to our childcare providers in the county. So if you're not sure, I would give them a call, send them an email to make sure that you're on their listserv, or that you have, if you've changed your phone number, your email, that they have your updated information. This will be partnering with our R&R agencies to share information about future webinars and other opportunities and resources related to COVID-19. And then additional resources for other support. We've included the information for community care licensing. As Lisa mentioned, you'll want to contact community care licensing if there is a positive case in your program. With regard to legal issues and provider rights, the Child Care Law Center is a great resource, and they're constantly updating the information on their page. You can also contact them with any questions that you might have with regard to any legal issues. As for small business support, there's currently a state grant program for small businesses. The website is there. They have extended their deadline. It is now January 13th. The information is available in additional languages, so definitely check that out. And lastly, our county ECE program has developed a website for providers with a plethora of resources for COVID-19. There's a lot of templates on there. Just anything that you can imagine, I think, related to COVID-19 is probably covered on that website. So please do check this out. And again, we will be sending out this presentation to all of you, so you can access the links from there. And I think that's everything that we have for tonight. So again, as I mentioned, we'll be following up with folks with the presentation. We are developing a frequently asked questions with all of the questions that were submitted to us both in advance of the webinar and that you all have submitted tonight. We'll also be including the links to the resources that Lisa mentioned tonight. Want to thank so much Lisa Erickson for being such an amazing liaison to our childcare community and for spending her time here tonight with all of you, with all of us, to share updates from the Alameda County Public Health Department. And also want to thank our interpreters tonight for being with us and to allow this language access. And lastly, to all of you who are out there on the front lines, just working so hard every day to help keep our families working, our children engaged and learning, and just thank you for everything that you are doing. You all are lifelines to our families in Alameda County, and we appreciate you all so much. So with that, we will be in touch, and everyone take care and have a good evening.
Thanks. And thanks to First Five for organizing everything. Appreciate you guys. Bye-bye, everybody.